When you talk about G6PD, I know Koda comes to our mind, the gospel musician who passed because he was a G6PD deficient patient, and a lot of things happened. We don't want to go into that. That's not what we are here for today. But may his soul rest in peace. Now, when you talk about G6PD, what are you talking about? G6PD is an enzyme that everybody or any normal person is having. So it's called glucose 6-phosphatase dehydrogenase enzyme. As a normal person, you have G6PD, and G6PD is not the medical condition. And the condition is G6PD deficiency. When you talk about deficiency, we mean you lack that enzyme. One a problem no. So someone like Koda, sorry for using him as an example, but someone like him, he had G6PD deficiency. It means he lacked the G6PD enzyme. And if you lack this enzyme, there are certain things or certain products that you are not supposed to take. And we go into that. Now, what is G6PD? G6PD is an enzyme, as I said, and this enzyme makes sure that your red blood cell is able to mature to its maturity stage, or the time at which it's supposed to mature. It protects your red blood cell from breaking down prematurely. So if you lack this enzyme, there are certain medications, foods and other stuff that when they come in contact with your blood, they cause your red blood cell to break down. And if that happens, you go into what is known as hemolytic anemia. It means that your blood cells is breaking down, you go into anemia, you have a lot of symptoms, you can even end up in the hospital. That's why G6PD deficiency is a dangerous thing, and it's a serious condition that everyone has to check their status. Now, if you're a G6PD deficient individual, there are certain medications that you have to stay away from. One is sulfur containing medications. Another one is aspirin, brufen. Another one is certain anti-malarials like Primaquine. You have to stay away from these agents. So when you go to the pharmacy to purchase any medication, kindly tell your pharmacist that, please, I'm a G6PD deficient patient. Can I take this medication? So that they will know and know which medication to give you. If you do not furnish them with this information, my dear, you are putting yourself at risk of undergoing serious effects because of the deficiency of this enzyme. If you do not know your G6PD status, I'll also advise you to go to the hospital and run a test for your G6PD status to be known. One thing about G6PD is that it is genetically inherited. So you inherit it from your parents, and mostly it is predominant in the male children. So if you are a male, you are at high risk of having G6PD. And also if you are from Africa, that's another risk factor. So if these two are positive in you, kindly go and check. Everyone should check their G6PD status so that you know if you are a G6PD deficient patient or not, so that you can know which food to avoid, which medications to avoid, as I have said. Then you can live long, because G6PD deficiency, without knowledge of it, can land you into the emergency room, and probably you can even die out of it. So please, let this repeat again, and let's get our G6PD status checked, and everybody will be free. This is Connect with Dr. Greg. Stay tuned for my next video. Bye bye.